Hello, my name is Dr. Alkisty. I work at Revitalise Dental Centre in Cornwall. Today I'm going to take you through my finishing and polishing of anterior composite bonding using the Microcopy dental burrs and polishers. So these are single-use burrs, fantastic, they're absolutely amazing. I've used them, I can't wait to show them to you. So let's jump straight in. So you've aligned your teeth, you have bonded your composite, and now it's this final bit of finessing on getting it just right. Here I've started with the carbide burrs. I want to get my line and angles just perfect. So I'm going in just next to the gingival margin just to try and get that seam of the composite as seamless as possible. I use quite a lot of magnification so I can make sure that I notice all the small details. You can hide them in small magnification, in large magnification, then you won't be able to see them. So here I've used the diamond polishing strips. I'm using a very, very thin polishing strip so I can get through the contact and push it through, so again I can polish that joint with the composite and the tooth. So we're going in through, and then you want to pull it right round the curve of the tooth. I'm going back now with quite a pointy flame burr. The point on this burr is absolutely fantastic, it's really, really precise. The carbide blades cut fantastically and I can get that ultimate precision that I'm looking for. I'm going very, very slowly here because what I want to do is get the precision and make sure that I don't create any steps. These burrs cut fantastically. You want to use low rotations and you want to go nice and slowly. I'm still in that same contact, making sure that I'm getting just ever so slight motions so I can get my line angles correctly that follow the curvature of the tooth. Here I'm using the discs, fantastic discs. The green one is the coarsest one. I'm using the thin ones so you can get that line angle. Once you've finished with your carbides, you go to the discs and you follow the curve of that canine all around just like that. Then you can drop your coarseness to a more medium one. You can use the coarse disc to do your basic shaping. However, the slightly less coarse disc can afford you a few mistakes and also gives you a lot more predictability and handling. So there we go. I've used a combination of wide discs and also the narrow discs to get what I want. I go through the middle of the tooth to make sure my seams are correct, and then I watch my line angles. So what I do here is I'm looking at how the light is hitting the tooth to make sure I'm matching that with the adjacent teeth. I go back and forth and do very small motions to make sure that I'm quite accurate and very tidy with my job. Working through the coarseness of the discs. What I really like about these discs is that they're very obviously color-coded. You have that dark green, you have the blue, you have the pink, you have the white one, so you know exactly what coarseness it is. You don't have to squint to look through different shades of green or red or whatever. They're very, very obvious. So nice and slowly, and you want to spend quite a long time polishing with these discs. Once you feel that the coarseness is now wearing away a little bit, you can change them. And that's what's amazing with these discs and burrs is that, first of all, they're always going to be fresh. You always know that you have just the right handling, the right coarseness. Especially with the discs, you can just swap it for another one. Here I'm using a sickle so I can check if there are any steps in my composite. You could use a very fine probe if you want to. I use the sickle so I can make sure I snatch anything, and I go back again with my diamond strip, make sure that I'm using the blunt end to get through the contact, and then I'm using the diamond part to work round the teeth. You will see me use it in an S motion as I'm going up the teeth. That will help me curve around the tooth and make sure I'm polishing around the contact but not taking the contact off. Here I'm using the composite point 1 to go over these seams just to make sure I'm getting that nice polish. Then I'll use the composite 0.2 to get that super high gloss. As I go around, I make sure that I wash everything and then go back on again. Wash everything, go back on again. Make sure you don't have any debris on that composite, so you can really make sure you're taking your time with a composite, taking the time to see how the light hits that tooth and make sure that you're manipulating this. So I'm going back in around the front. So what you want to do in the facial of the tooth, you don't want any light hitting it. You want it to hit the line angles around the tooth. So as you're polishing through the middle, you're actually doing your patient a service because the light is going to be hitting the sides. You want to make sure that the line angles of every tooth are parallel to each other, however you chose to create them, and they're in the right width. So I'll interchangeably use the points with the cups. I'm using the cups especially on the incisal edges, on the canine tips, and through the middle to make sure I'm getting that nice rounded polish that we want. If you're polishing from all different angles, you will finally get that super smooth surface that you're looking for. So now I'm going with that final disc just to get that nice rounded polish that we're looking for, so you can get any scratches that you may have happened with previous discs, any scratches that may have happened with your carbides. You want to smooth all that out. You want to keep washing the teeth, keep resetting, make sure you're getting all the debris off, so you can really check. If you have a lot of debris on the tooth, it can be really difficult to see what you've done. You can see on that central incisor how shiny that is. This is so exciting. Super shiny again. Now I need to make sure that my lateral's doing the same. I'm following the gingival margin. Make sure that where I put my composite is completely invisible. So I'm going all around again with the cups and the points. I love these points. Now as a final finish, I like to use a polishing paste and goat's hair burr to get those last little bits. You want to check the palatal, make sure that you're very happy with it. So I go again with my sickle, make sure I'm getting any debris, washing that all off again. Now we're going to move to the left side. Again, you can see me use the nice pointy flame to really tuck into that gingival margin, get right in there. You can see how that step in that composite is smoothing out. Whatever step may have been created from that pointy burr, if you can't get that through, you want to use that nice diamond strip. You want to check that the palatal surfaces have almost as much anatomy as you put in the front. You want to make sure when the patient is occluding, when the patient is guiding, that they're guiding against not a flat surface, but something that's functioning. This 12 blade carbide is excellent for this work. The handling is so smooth, it just never jumps. So you can see the difference from the right, which we've just polished, to the left, which we are polishing now with this composite point. You can see how much difference, or the difference in shine from one side to another. So we're going to go again with a narrow disc first, coarse, just to get all the big bits through and get my line angles where the light is going to hit your tooth first. So you want to get that right. I use very low rotations to get that, so I don't cut too much, I don't lose too much of the shape that I've put in. And we're working through the coarseness, getting through finer and finer discs. Again, I can't stress enough, you want to be polishing, you want to make sure that you're washing every time, you're getting all the debris off, and you're checking. You can obviously, sitting behind the patient and looking down can sometimes be quite disorientating when you're polishing teeth, especially when you're shaping them. So sometimes I will pause and I will go in front of the patient. Sometimes I'll sit them up and make sure that what I'm looking and how the light is hitting the patient's teeth and their smile is what I want to achieve. If you don't have a window in your practice, you might want to go to a window. You might want to have a light source just to check how the light is hitting is matching all the teeth. The interproximal surface back to the front. That's to make sure, first of all, I'm getting that polish, but also I'm maintaining the line angle that I've put in. And then so I go from the facial and then from the interproximal working towards the middle. If I'm working round the curvature of the tooth to the incisal, I make sure that I curve that disc so I can get the maximum from my very, very fine diamonds back on the sickle, just to make sure that I'm not leaving any steps or any edges. Now back again, washing it again, having a look and using that cup. You can see where I'm using it on the canine, in the tip and along nice slow rotations so I can get that precision that I want from my cups. So now I'm with my high gloss point, just getting through the middle. Just because the light's not going to hit the middle as much as the sides, I still want that shine all throughout. Because you can see some little marks on that upper left one. So we want all these eliminated. We can go back and forth. So if you feel that you've worked through your discs and through your cups and through your points, and you can still see a few scratches, a few marks maybe from your discs, you can drop back again on the coarseness and work your way back up in that particular area. However, be very, very careful if you're going to go back to the very, very coarse discs, or if you're going to go back to your carbides, you don't want to take too much off, because then you're affecting the anatomy of the tooth. And we're back again. I'm pleased, I'm happy with what I've done with my polish, and I'm just going to use that polishing paste just to get any just last little bits off with that goat's hair. Make sure you wash it. Make sure you wash it really well. And again, stand up. Go in front of your patient, ask them to smile. It's a good idea if they can see as well, if you feel comfortable with your patient looking and seeing what you're doing throughout the procedure. Sometimes they can pick up stuff that you can't pick up. Here I'm checking the occlusion. I'm making sure there are contacts throughout. And what you also want to check is that the gliding pathway is correct as well. So you don't just want to get the contacts. You want to make sure all the excursive motions that the patient is gliding against your prepared composites, or you're adjusting these. It has to feel even throughout. In this case, I'm not too worried, especially about the lower incisors. You can see we're going to polish them next, so make sure you catch the next video where I polish the lower incisors and I take you through. Back again, checking with my mirror. Nice little contact on the canine. A little bit heavy. I'm getting my carbide, polish that off. Lovely. I'm linking everything on the video, so you can see all the burrs, everything's linked at the bottom as well. You can go and find them on the Microcopy website. Lovely burr, this one. Nice and round edge, so you can dip in to the cingulum rest. You know you can create a nice rest with this burr, and you can also cut from the side, so you can get the occlusion on the palatal as well as working through the cingulum and getting that anatomy. Make sure you use your articulating paper again, get the patient to bite through, check again. I've enjoyed using them so much. The carbides are just phenomenal. I can't believe how smooth they glide, how they will always cut. They will always be predictable. The milling is phenomenal, so I know I'm not going to break any burrs. I'm not risking anything like that, and I'm going to get that nice, super smooth glide and predictability every time I use it on every single patient. It's really, really important that the tools that we use are predictable and they're the same every time, because sometimes you might have good days and bad days, but if you have everything around you that you know exactly how it's gonna work, you're not getting any stepping, you're not going to get any skipping of these burrs. You have the confidence then to always know how that hand and that burr will be working on your materials. I hope you have found this video interesting. I hope you some of the tips that I've explained have been helpful. I hope you can see how important it is that your tools are the right ones, and how important the last final step of finishing and polishing is to get that incredible result that all the patients want ultimately.